If somebody who's experienced breast cancer requires surgery to deal with it, it is an important, powerful, potentially healing medical procedure. However, it can leave behind both physical and emotional scars as well. It has been noted in medical reports how survivors of such challenges can deal with things like anxiety, depression, and even body image concerns. What's the latest in terms of advanced scar management and aesthetic recovery for breast cancer survivors? We're learning more on today's edition as I speak to Dr. Jeanel Goh, who's Medical Director at Alpha Asia Aesthetics. It's a member of the Beyond Medical Group. Dr. Goh, hello. Thank you for joining me.
Hi.
Good to talk to you. Let's understand about these scars a little bit. Most people would think, any surgery might have some scars. What is so unique about these particular scars? Can you talk to us about where would the scars tend to be and how prominent could they be as well?
Well, actually, scars, they're like a natural part of the body's healing process. And when we talk about like breast cancer surgery scar, we usually talk about like a lumpectomy or a mastectomy. So they tend to be very apparent, like in the front of the chest wall, or sometimes when they have to remove some lymph nodes, it's actually at the armpit area. And sometimes when it actually spreads to the nodes on the neck, it can have some scars at the lower, the neck as well. Yeah.
And can they be quite large?
They can be. It really depends on like the size of the tumor and the extent of how much it's being cleared and removed during the surgery. Yeah.
And it's lifelong, right? These scars do not heal.
Well, I mean, the scars, they go through a process of like maturation. So initially it'll tend to be red, more lumpy, more raised. And usually like surgeries, they can have some complications that actually impact the wound healing. So over time, the wound will mature. It tends to lighten, but usually when people come to us for treatment, we try to reduce the appearance. We try to improve how it's like, but it doesn't usually go away completely. Yeah.
What do we know about how it does affect the emotional well-being of the breast cancer survivor? Because here they are having been challenged with the breast cancer and defeated it in a way, which in and of itself is a huge accomplishment, but they are left with the scars of it. How does it affect their well-being?
Well, I mean, it can have like a really profound negative impact on the breast cancer survivor emotional well-being because it affects their self-image and confidence. So the scars, when they are so visible, they can really constantly remind them of their illness and make them accept like the acceptance and emotional recovery more challenging. Because sometimes we don't really address the scarring as we focus our care on the cancer itself. But actually addressing scarring is a very important part of the recovery process to help survivors to actually rebuild their self-esteem and feel more positive about their bodies after cancer treatment.
Now, when it comes to some of those procedures, you described the lumpectomy or the mastectomy, for example. I've talked about on this show how certain procedures like breast reconstruction surgery, which can be done in the same sitting, can help in terms of, in terms of self-esteem, in terms of appearance and things like that. But there can still be scarring with that regard. But we have to bear in mind that not everybody chooses that option and might be left with the scars and the remnants of it as well. Can you talk my listeners through what are some of the more effective treatments that are available for post-surgery scars?
Well, actually, it really depends on what type of scars it will be because, like I said, for every individual, it's actually very different, the way they heal, the extent of the operation. But sometimes the most common ones that we see are like when there's like the wound tries to heal, but it's overzealous in healing, so it's actually excessively healed. And usually this happens, they will actually result in a hypertrophic scar or like a keloid. So they are quite similar in some extent in which there's excess overgrowth of collagen. However, hypertrophic scars tend to be more common, whereas keloids tend to be like a little bit more aggressive in its nature, a bit more scary, a little bit larger, bigger than the wound extent, right? So when they have scars like that, then we actually offer them some combination therapies like using a bit of steroid injections to soften, to flatten the scar. But actually there are other types of scars that may happen with regards to their recovery. So sometimes some patients, they're actually concerned about like the discoloration. This is actually otherwise known as like post-inflammatory hyperpigmentation. And when that happens, the concern about that, then we do a bit of laser therapy to help reduce the redness and even out the skin color, right? And sometimes for some patients, after the scar is flattened, they want to improve the scar texture, then we perform a combination of like microneedling with radio frequency, such as like Morpheus8, together with some injectable therapy like polynucleotide therapy to help with scar remodeling and improve the overall scar aesthetic outcome.
And this can be these sound very minimally invasive, actually, for the most part, so there's no excision that's required, because I heard for keloids, most of the time you do need some kind of excision to help deal with it. But maybe when you think about it, a patient who's been through the breast cancer surgery might not want any more incisions in that area as well.
Yeah, exactly. Because actually the keloid happens, it tends to have a genetic like predisposition, like people with some genetic history, or they are slightly younger, or if they are darker skin, they tend to have a higher risk of getting keloid. And the keloid happened because there was an initial insult to the skin, like an incision. And so actually incising the keloid may actually cause more worse outcome instead of a better outcome. So we do have to be really, really careful with patients with keloids. And usually sometimes when we actually treat the keloid, they can have a comeback. They can recur, right? So sometimes the counseling is very important. We do things like, put silicone sheets, to help to calm down the keloid. Usually these are probably more adopted in the event of having a keloid.
So are we talking about a reduction in the appearance of the scar or an erasure of the scar's presence? It all depends, I guess.
Yeah, it all depends on the individual. So normally, even before we propose a treatment plan for our patient, we'll sit down and talk to them, right? Understand what their concerns are and what's their expectation, then we will discuss with the patient to what extent it's reasonable, in order to help reduce the appearance of the scars. Like I said, it doesn't really completely go away, actually. Yeah.
Dr. Goh, in terms of timing, how soon after recovery from the breast cancer surgery can they consider something like these advanced scar removals or aesthetic treatments for scar removal?
So, if, for example, immediately post-surgery, they can actually do a bit of non-invasive treatment, such as silicone gels, light massage. They can be initiated 2 to 3 weeks after their stitches are removed.
That soon?
Yeah, that soon.
Actually, is it better if it's sooner?
Yeah, kind of.
Okay.
Kind of, yeah. But for example, the more intensive treatments like the laser therapy or microneedling, it's actually more advisable to wait until the scar has fully matured, typically around 6 to 12 months after surgery, to allow for optimal healing. Yeah.
I wonder, so that means really you got to plan for it a little bit lah.
Yeah.
In terms of, you're going for the surgery, and then you're also going to plan for the post-surgery scar removal or scar reduction.
Yeah. Exactly, because sometimes it depends on the biopsy of the breast cancer. So if it comes back to be above a certain stage and they require radiotherapy, then I think they will have to go for the radiotherapy first before we can do any form of treatments to help augment the scar for them. Yeah.
And I also wonder, speaking of timing, because I'm sure I've got many listeners who have been through the breast cancer surgery experience maybe quite a while ago, but are still living with the scars. Have you ever missed the boat? Is it ever too late to address the scars?
Well, I guess nothing is ever too late, because if it really bothers them, it doesn't, they can step up and actually seek help to actually help them to, improve the appearance of the scar. There's nothing really too late. But of course, when the timing is you time it really well, you do it earlier, probably the outcome will be better. So we do offer some injectables, right? So it not only helps with new scars, but even old scars, it can actually help to remodel the collagen and help to actually improve the appearance of the scar as well.
Wow. I've talked about some of these treatments on my show before. I didn't realize that they could help in this context as well, like Morpheus8 and so on and so forth. Are these in what these technologies and procedures are indicated for? They're utilized for this? It's not just about aesthetic appearance and making your skin look good and feel better?
Well, I guess it has the primary indication for Morpheus8, it's like a state-of-the-art technology, and Kim Kardashian made this super famous. Yeah, because she uses it and then everyone comes to the clinic to ask for this, right? That's in the sense of a cosmetic way. But when we talk about, why this is good as well. It not only helps with like scar remodeling, it has other peripheral benefits like improving the skin texture and enhancing the skin laxity. So it's not, I mean, we choose not to talk about it in a way that, it's just only for scar improvement. Yeah.
Absolutely. Good reminder there as well. Now, let's talk about let's say the person has planned this routine with the doctor. You have tailored the treatment as well, depending on the kind of surgery that they're going for. And you've worked out the plan. We've got the timeline and it's sorted as well. But are there things that the patient also needs to do or can do immediately post-surgery to help minimize the severity of the scarring?
Yeah. Sorry? Like,
are there things that the patient can do immediately post-surgery to help minimize the appearance or the severity of the scarring before coming to see you? They're doing things on their own as well to make sure it doesn't scar up.
I see. Yeah, so immediately post-surgery, actually simple things like gentle wound care, having a balanced diet, making sure they are enough like hydrated, can use some silicone gels, and all these can help minimize scar formation, right? But another thing that is actually very important to note is that sometimes after they actually go through the surgery, they have actually some complications that follow breast cancer surgery. Things like edema, lymphedema, muscle weakness, loss of shoulder motion. All these can actually impede their wound healing. So for example, if the area is actually a lot of swelling is there, it can actually impede the blood flow and actually prevent the scar from actually healing well. So it's very important that, we recognize these complications post-surgery early and we act on them to actually help them to heal their wounds faster, right? I mean, there's also other lifestyle things that they can do, like wearing a support bra, avoid smoking, and also like using emollients to help with the skin quality. All these are also small things that they can do in the immediate post-surgery period.
I love that we spent this time talking about post-surgery scar management. I don't think it's talked about enough, honestly. Very often, I mean, I guess I understand the specialists might be thinking, I'm not just talking about breast cancer, I'm just talking about a lot of health issues that I thought about here. The specialists might just be thinking about dealing with the health issue, getting rid of the problem, solving that situation. And then that mindset means, okay, I've healed the patient, we've dealt with it. But the psychosocial aspect of scar management, and we do have tools and techniques that can actually help as well. Why do you think we're not talking more about post-surgery scar management and healing? We should be seeing more of it. It should be part of every surgery process, I think.
Well, I think in scar management is actually really under-prioritized in post-surgical care because of the limited awareness, and people actually focus more on the primary cancer treatment. So actually educating survivors through like consultations about scar healing treatments, treatment options, and actually setting up like realistic expectations can really help them to make more informed decisions about, what they can do and their options, right? So all these, like, we provide resources, routine follow-ups, then all these can specifically address, any of these concerns should they have.
Because it does feel a little bit like the patient has to do the homework to find out there's such a thing as scar management. Like, is this part of the discussion that the surgeon would talk to them about?
Well, I guess like because in recent times when all this technology, their prognostic is so much better. So people talk about not just healing the cancer, but after healing, living longer and living better, right? So actually, I think this is increasingly a more like, they talk about it in their discussion, but it really depends on, the surgeon consulting on that, because sometimes, if they have a very full clinic, they may not even have time to cover this. But I think it's good because if there's this awareness, then people are more willing to share. And like what you said, it shouldn't be the patient doing the homework. It should be an option offered to them as well. Yeah.
Finally, before we let you go, Doctor, what do you think is the most exciting advanced treatment that you're most excited about, that you're seeing very good results from in terms of advanced scar treatment?
Well, I think like in terms of like the recent technologies and advancements and all that, I think what is really is actually like fractional laser technology and like Morpheus A. All these are like, they combine 24K gold microneedling technique with radio frequency to really remodel the scar and help with like overall improving the scar appearance. But in recent years, there's increasingly more people using injectable therapy, whereby they use like polynucleotide therapy, like some form of like salmon DNA, where they extract it, to help to revitalize the tissue and help the scar to grow and mature. Even for new scars or old scars, it does help to augment the scars, regardless of like the age of the scar, like you mentioned previously.
I'm impressed that such techniques are existing, but Dr. Goh, sound very expensive lah. Like all this kind of thing. You just know with cancer surgery is very expensive also, all this kind of thing. That we can moderate our expectations, we can work with our doctor, we can work out a plan for the like, okay, no, I'm gonna minimize, I can't do this kind of combination. We can find what works though, right?
Yeah.
Because this technically isn't something that is insurance claimable, technically, unfortunately.
Yeah, it's not insurance claimable. I mean, I always tell my patients two things. I don't sell Botox. In my clinic, I sell dreams, right? People want to walk in, they want to walk out feeling happier, more confident about themselves. And like I said, like I will never be the cheapest, but neither will I be the most expensive. But it's more about the value that I can deliver to their lives. Yeah.
We need to talk to our insurance companies lah. I mean, both breast cancer, surgery removal, that has to be something that we can claim right next time. Okay, Dr. Jeanel Goh, thank you so much for your time. Medical Director at Alpha Asia Aesthetics. It's a member of the Beyond Medical Group. This has been Health Matters. I'm Daniel Ma.